First of all, I don't trust Elon Musk. Allowing electrodes to be implanted in my brain just to enhance user experience or let me control everyday objects with my thoughts requires serious weighing the proven safety features and potential seamless integration against the unknown ethical, medical, and long-term consequences of such a sophisticated neural interface. By the way, I'm Shanaida Villanueva. So, what exactly is Neuralink and how it is connected to electrode implantation? So, Neuralink is a neurotechnology company founded by Elon Musk in 2016 that develops implantable brain computer interfaces, or the what we call BCIs. These devices decode brain signals to let user control external devices like computers and phones using thought alone. So, according to Forbes, Neuralink faces significant technical, ethical, regulatory, and scalability challenges that threaten its ambitious goal of enabling thought controlled devices and human enhancement. First, the core technology of Neuralink. So Neuralink's N1 implant, or what they call Link, is a coin-sized device implanted in the skull. So this contains 1,024 electrodes spread across 64 ultra-thin, flexible threads, thinner than a strand of hair. So these threads are inserted into specific brain regions using a precision surgical robot to minimize tissue damage. The implant wirelessly records neural activity, sends data via Bluetooth to an app, and translates it into action like cursor movement. It also contains a rechargeable battery. For its goals and progress, the first goal of this link is to help patients with paralysis restore communication and mobility, such as playing games, controlling robotic arms, or operating devices independently. Long term ambitions include treating neurological disorders, achieving human AI symbiosis, and even cognitive enhancement like improved memory. As of late 2025, more than 12 people have been implanted uh, under the FDA approved PRIME trials, with reports of thousands of hours of stable device performance and peer reviewed data now submitted. So, returning to the main point, deciding to implant electrodes in my brain means balancing current technical enhancement achievements, with the still uncertain risks. First, technical limitation. Early issues were serious thread retraction affected the first patient significantly, up to 85% of wires withdrawn by mid 2024. Later surgeries reduced this problem and improved stability, and by late 2025, 12 patients collectively record more than 2,000 days and 15 hours of use. They controlled cursor, games like Mario Kart and chess, CAD tools, social media, and even robotic arms. However, uh, critics point out that some of the electrode design is based on older approaches. Bandwidth still falls short of Neuralink's megabit level goals. Long term risk like gliosis or the scar tissue and the electrode degradation remain unclear due to limited multi year data. Compatibility and propriety limits also restrict broader application. Second, the ethical and safety concern. Animal testing controversies around 1,500 animal deaths from 2022 to 2024 sparked investigation. Though no major escalation were reported in 2025, human trials now received closer to scrutiny with ethics boards enforcing the importance of informed consent and transparency. Neural data privacy remains a major issue if a device can decode brain signals. Like, who owns that data? How do we protect it from misuse? These concerns are amplified as more than 10,000 people have signed up for these trials. Third, regulatory and scalability hurdles. While FDA has expanded prime trials and granted breakthrough devices status for a related application, large scale adoption, is still far away. Neuralink's R1 robot has improved surgical speed and aims to reduce implantation costs from $10K to around $1 to $2K, but highly specialized procedures still limit availability. Meanwhile, competitors like Synchron offer less invasive approaches. Neuralink's long term goal remains uncertain. So, for my stand, I would not allow electrode to be implanted in my brain to control devices with thought. Despite promising early results, the long term safety, reliability, and ethical safeguards are far, far from assured. Risks like brain tissue damage, device failure, and privacy breaches involving neural data remains a serious concern. Issues of consent, uh, potential data misuse, and widening social inequality also weigh heavily against adopting such invasive technology at this stage. Until the technology becomes safer, more transparent, and more accessible, and until long term impacts are clearly understood, I would not be comfortable participating in it. Thank you.